So let's go ahead and get started. I'm pleased to introduce Dr. Christian Ambler, who's one of our wonderful psychiatrists who will speak on cognitive and learning issues in children with epilepsy.
Hi, thank you, Nancy. Can you hear me?
I can hear you just fine.
Great, thanks.
Share your slides.
I'll go ahead and share my slides, and let me introduce myself as well. So like Nancy said, I work at Stanford Children's Health. I'm a neuropsychologist, and I see kids in a variety of different clinics, and of course the epilepsy clinic being one of them. And oftentimes one of my big roles is to help figure out school plans and do school advocacy pieces, not to mention just, of course, answer referral concerns and concerns with attention and cognition and learning issues, but to also kind of help out with what kind of school advocacy needs need to be implemented based upon, the concerns that a child has. But I'm gonna go ahead and share my slides. I have some slides, so I should be able to do this okay. Gotten rehearsed at this since the COVID pandemic with doing telehealth testing. Okay. Let's see. So can you see my slides, Nancy?
Perfect. Thank you.
All right. So my topic is cognitive and learning issues. And please, if you have any questions that pop in your mind, just type them in the chat box, and I'll try to certainly leave some time at the end to address them. I have my contact information at the end also to go over things, but I'll be talking about the cognitive and learning difficulties, mainly with kids with epilepsy. I'm going to talk about the common complaints that I see and their associated problems, and how that relates to the neuropsychological assessments that I do, and how that informs the next steps. So of course, starts with the concern, trying to understand what the underlying problem is, trying to assess it, and then trying to figure out what are the next steps. So is there, what kind of school plan do we need? Is there a 504 needed, or an IEP needed, or some in-home supports that are needed? So these are the kind of areas I'll kind of go across, kind of jump back and forth through my slides. So the first piece is cognition. Sometimes I think there's some questions about what exactly is cognition. Cognition is thinking. So it's how well do you acquire information? So how well does your child bring in their knowledge? How well do they understand? Some kids are verbal learners. Some kids do really well with verbal learning tasks. Some kids are visual learners. They do really well with the visual things, the visual prompts, the PowerPoint slides. I'm a visual learner. I like PowerPoint slides. So we all have our ways of, what works best for getting our information in. But attention, cognition involves a lot of other things. It involves attention, concentration, perception, being able to form the knowledge and understand it. So there's involves memory and learning. So these are all part of cognition and part of the concerns, and part of the things I'll be looking at today is the memory concerns. And it also involves more executive things like judgment and reasoning and decision making and problem solving things. So cognitive complaints are common in kids with epilepsy. Certainly there's awareness around the child's learning. The complaints or the concerns may be raised by parents, by doctors, or by teachers in the classroom. Often memory concerns are one of the more common features of some of the epilepsy syndromes that I see for who get referrals to see me for assessments. Sometimes there's often attention problems and attention concerns. Some of the kids have more subjective complaints or academic problems. Some of the academic problems are noted by the teachers with reading comprehension or word reading, or with writing, or with math skills, or with doing written problems, or even making simple mistakes on math worksheets and such. Some of the common complaints relate to language. So there's the expressive language and receptive language. There's visual spatial skills, and there's executive functioning. I'll explain executive functioning in a couple slides ahead. And there's often speed and efficiency. Some kids are super fast and they get the work done really quickly, but they make a lot of mistakes. Or some kids are efficient and they get it done and there's no mistakes, but it takes them a darn long time to get the work done. So it's there's an efficiency factor in there. How efficient are they with getting pieces done? Let's see. So the next slide. So with the memory complaints, I'll start with the memory first as a common complaint that we get, that I see concerns. Parents report that my child can't remember things. They forgot what they did yesterday. They can't remember what happened in school. They can't remember what they did that day in school. They can't remember what the teacher said. Some parents report they can't find the words. I was seeing a kid a couple of days ago, and he was trying to explain what he did last weekend. He said, well, you know, I did that thing where we went out and, you know, we got candy. We went door to door. What's that called? He says, you know, we got candy. We went around. He couldn't think of Halloween. Couldn't think of the word Halloween. Of course, it's a pretty common word that we hear right now at this time of year, but he just couldn't pull that word out of his memory banks. So sometimes parents report they have a hard time finding words that they want to say. Some kids have a harder time remembering names or remembering people. Some kids, some of the complaints or concerns are they forget what they're supposed to be doing. They went up to the room to go do something and they forgot why they even walked in the room, or have no idea why they went in there to do what they were ever supposed to do. Some of the concerns are, well, my child tells me something and then 5 minutes later tells me the same thing and has no awareness that he just told me that. So they may say the same thing over and over and not really realize that they're kind of repeating information. In school, some of the kids forget assignments. Some of the kids may get the work done and leave it in their backpack and never even turn it in. Some kids forget the schoolwork and they come home and say, oh, my teacher doesn't have any homework. There's no homework. Lo and behold, a couple of days later, you find out that there was homework and it wasn't done. Some kids misplace things. They lose the homework. They lose the pens. They lose the pencils. They lose the notebooks. They lose the science books. And some kids with the memory problems is they can't remember what the teacher just said. They were in school today. They explained the math, and I have no idea the kid says about, you know, what happened. So these are all some of the common memory concerns that I see sometimes with epilepsy kids. And then when I'm looking at this, you know, the assessment often starts with a pretty detailed history gathering to try to understand what are the concerns of the parent and the doctors and the child and the teacher, and then how to address it. So when I'm looking at concerns that are related to memory, you know, there's certain aspects of memory that I'm looking at. There's verbal memory and visual memory. So some kids have a hard time with the verbal memory part of it. So it's, are they having a hard time with the auditory part of the classroom? The teacher says something, are they not following through? But for a memory really involves 3 steps. So how do you make a memory? How do you get a memory? Well, there's 3 steps. First, you have to encode the information into your mind. You have to put it in your brain. Then you have to store it in your brain. You have to file it and put it away somewhere. And then later on, you have to pull that information out and tell it to me. So maybe 1 minute later or 3 minutes later or 30 minutes later, you have to pull that information out and tell me what you learned or what you remember. So when I'm looking at memory concerns, I'm really looking at these 3 areas because there's different processes that may affect these areas. And that really addresses, well, how do we address it in the classroom? So the first part is encoding. So this involves attention. So you have to pay attention. The first part, you're not going to get any memory if you don't pay attention. So there's an attention aspect. So when there's a concern for memory, I'm certainly looking at attention and concentration because that can affect memory. That's the whole first part of memory, is having to encode it and put it in your mind. And it involves learning. Some of my tasks, I repeat things once, or I repeat things 5 times. So I may say a word list over and over again and see how well a child does, you know, if I repeat the information. Sometimes in the classroom, the teachers just say things once, they don't repeat things. Some kids need to have the information repeated a couple of times. For the encoding piece of it, some kids need to have a visual prompt, a visual cues to help with the encoding. So that's part of the memory assessment. Next part of the memory assessment is storing it. How do they store the information over time? Is it consolidated and kind of put away in their memory banks? Or is there forgetting as time goes on? And the third part of it is retrieval. So if I ask them, well, I ask your child, you know, well, remember that list of words that I read to you 30 minutes ago, can you tell me all the words that you can remember? So there's the retrieval part. So did they encode it? Did they store it? And if they did, can they pull it out of their memory and tell it to me? And sometimes the retrieval is difficult for them. Some kids know the information, but they just can't get it out of the memory banks. So in those situations, it's helpful for me to say, well, okay, well, On that word list that I read to you was one of the words boy, or was it one of the words pale? Was one of the words dog, or was it cat? So sometimes helping them recognize the information helps with retrieval. So that kind of guides school planning then, that when the teacher calls on them, instead of just cold calling them and saying, okay, Johnny, tell me everything that you know, the teacher can give them some prompts and say, okay, Johnny, tell me everything that you would recall about the story, and talk about the first paragraph when John was at home making dinner. So providing some like cues and some prompts can help with retrieval for some kids. So that's the memory part of the assessments, looking at that area. And now I'm going to talk about some of the attention concerns. So some of the, like I said, some of the common complaints that come into the epilepsy clinic for the kids that I see have attention problems. So these kinds of complaints relate to, well, my child forgets what they're supposed to be doing. They're doing something and they forget it. They can't follow multi-step commands. So this kind of attention problem in school might be the teacher saying, okay, class, get out your science book, turn to page 12, and do the odd items in the back of the book and turn it in on the way out the door. So these are multi-step commands that the kids have a hard time with. Some kids are easily distracted. Some kids say the same thing over and over again. They can't remember what they read. Some kids may read a paragraph or read a page and have no idea what they just read. Some parents report that my child's spacey. Some parents report that, well, I'm speaking to them, but they don't even appear to be listening, or some kids are forgetful. So these are some of the attention areas, and when these are the common concerns or common complaints, I'm focusing on areas of attention during my assessment. So I'm looking at simple attention versus complex attention. So simple attention is it's kind of like simple clerical tasks, effortless tasks. I'm looking at complex attention, kind of working memory things. If I tell them some numbers, a series of numbers, can they tell me the numbers backwards? Some more complex attention. I'm looking at divided attention. So in the classroom, this is when the teacher's talking, can the child take notes? Can the child listen to the lecture and take notes at the same time? So they're having to do two things at the same time. I'm looking at sustained attention. Sometimes this is the area of difficulty. They can do all these simple little attention tasks. They can do the complex attention tasks. They can kind of go back and forth, but they have a really hard time listening when the teacher goes blah, 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 blah. So sometimes that sustained attention is the weaker part. There's verbal attention versus visual attention, and then there's that sequencing multi-step thing. So when the focus of the assessment is on attention, these are some of the areas that I'm looking at. And then this kind of guides what kinds of interventions and accommodations might be needed in the classroom. For example, some kids may need to have, instead of the teacher saying, get out your science book, turn to chapter 12 and do the odd items in the back of the book, the teacher just may need to write those three things down on a little Post-it note and walk by your student's desk and just put that Post-it note on their desk. So instead of getting that information out of working memory, getting it out of attention and just put it on a little piece of paper, and that kind of helps with them with the working memory part of it. And some kids, if the difficulty is with more sustained attention, those kinds of kids often need more motor breaks, more checking in, checking for understanding sort of accommodations. So like I said, there's some of the complaints that I get are related to language. Some of the epilepsy syndromes can result in more language difficulties or language concerns. So some of these things are, well, my child doesn't understand what others are saying. The parents may say, my child doesn't understand what the teacher's saying. Some children need information repeated. Some kids have a hard time explaining their thoughts and telling what they know coherently. So in the classroom, when they get cold called or the teacher calls on them to explain something, they know the information, but they have a hard time kind of verbally explaining it. So there's that expression piece of it. They can't explain their ideas. Like I said earlier, some kids can't find the word that they want to say. So there's like a word finding difficulty. And then there's the verbal fluency part where some kids have a hard time with the speed of language. So out on recess, can they jump in the middle of a conversation and keep up with the speed of the conversation? There's kids are out there at recess and playing handball and talking and telling each other things. And, it takes speed, it takes verbal fluency, it takes verbal speed to kind of jump in and do that. And that's an area of language concern at times. So when the assessment has referral concerns are related to the language complaints, these are some of the areas that I'm focusing on during the assessment. I'm looking at expressive language versus receptive language. So some kids have a harder time expressing, some kids have a harder time receiving language. They have a harder time with poor comprehension. I'm looking at verbal fluency. I'm looking at naming. I'm looking at repetition, verbal repetition. I'm looking at verbal reasoning and verbal problem solving. And I'm looking at nonverbal language also as part of the language assessment. So there's gesturing, there's nodding, there's smiling, there's showing facial gestures, there's hand gestures. So there's a lot of nonverbal parts of language that occur. And that's part of the language assessment as well. So the next part is executive functions. And this is an area of concern for some kids with epilepsy. Executive skills are more of a frontal area task, so the front of the brain kind of skills. So more epilepsy syndromes that involve more frontal brain regions can result in some executive skill difficulties. So with executive functions, you can think of like what is an executive manager? So an executive manager has to come up with a plan. They have to run a team. They have to do planning. They have to do organization. An executive manager has to get people motivated to get going. They have to have organize a team. So when there's something that doesn't work, they have to be able to stop and switch tasks, come up with new goals. So that's what executive functioning is. How well can your child be his or her own executive manager? Or are you their executive manager? So how well is your child at initiation? How well can they sit down and get started on homework? How well can they sit down and get started on a writing assignment? A writing assignment involves planning and organization. Can they sit down and just start writing their thoughts out? Or is your child one of those kids who has great ideas, but just can't put it into words, just can't get it written out? There's time management. Some kids come home and say, oh, that'll take me 5 minutes, and that'll take me half an hour. I'll do it later on. So there's the passage of time. Is that homework assignment really going to take you 5 minutes? Is that half an hour really half an hour? You're going to do it later, or is it actually going to be 2 hours when you do it? Is that assignment going to take you 45 minutes instead of 5 minutes? So there's the passage of time and time management. There's task monitoring, part of executive skills. So when you're working on an assignment, when you're working on problems, are you self-monitoring? Are you kind of stepping out of yourself and looking down? Are you aware of your mistakes on a math worksheet? Are you following the plus minus signs? Are you carrying the numbers? Are you aware of that as you're doing it? Are you kind of self-checking? And even task monitoring at recess too. There's are you able to kind of step out of yourself and kind of do that behavioral regulation part? So the behavioral regulation part is also a part of executive functions. So some kids who have executive difficulties have a hard time not only with those cognitive things that I just talked about, but may have a hard time with more behavioral, emotional regulation. So you can kind of think about like when your child gets upset, is your child getting upset at things that other kids don't really get upset at? So it's sort of lower thresholds. Some kids with executive difficulties have lower thresholds. Things that don't bother other kids bother your child more than others. Or when they do get upset, is it harder for them to kind of reset? Is it harder to just let it go and not worry about it and keep moving on? So some kids have a lower threshold, they get upset easier, and then it's harder for them to kind of let go and move on. So those are part of executive functions as well, not just the cognitive piece, but there's the emotional regulation and the behavioral regulation part of it that can affect cognition and behavior and such. I do like to look at visual spatial skills. Sometimes this is an area of strength for some kids. Some kids do really well at visual spatial things. Some kids don't. When there's a reason why Google Maps, if you need to go somewhere or you print out Google Maps, it gives you a visual map. So some kids do really well when they look at that visual map, or some adults even do really well when they look at that visual map and know exactly where they need to go. They have really good visual spatial skills. They have good spatial orientation. Sometimes when Google Maps gives you that visual map, you have no idea what that map says. You get even more lost. You have no idea how to read the map or what's up and what's down and how to orient the map. So those kinds of kids may have a harder time with visual spatial skills, which is why Google Maps also gives you a printout that says turn right at Jefferson Street, go a half a mile, turn left on Jackson Street, go 3/4 of a mile. So there's that the visual spatial part of it. So kids who have visual spatial difficulties in the classroom, they might have a harder time reading charts or graphs or diagrams or figures. They may, a teacher may put up a chart or a diagram and they may have a harder time kind of like figuring out what does that graph say. Just like with Google Maps provides you with that verbal cueing, turn right, turn left. Some kids need that verbal cueing in the classroom. They kind of need someone to help them. Well, on this chart over here, this is the bottom of the line, shows the number of kids at the dance. Like this line up here on the side shows the number of schools that participated in the dance. So providing them with verbal cues and verbal prompts to help with the visual spatial things. With the visual spatial things, there's that gestalt problem. Some kids see the forest, they get the overall idea, they understand the whole concept of things, but then other kids could kind of get lost in all the details. They don't see the overall picture, they get lost in the forest, they get lost in the trees. So visual spatially, kind of with your visual spatial sketch pad and your whole visual orientation of everything, how well are you able to kind of step out and look at the whole problem in your head, kind of look at the whole thing? Or is just your child was having a harder time with the overall picture and just kind of gets lost in the details? And then of course, there's the visual reasoning, the visual problem solving, and there's also visual perception as it relates to facial perception. Part of the assessment for the neuropsych assessments and the referral concerns relate to processing speed, how quickly they're getting work done, processing speed and related to academics like reading fluency, math fluency, writing fluency, verbal fluency. There's reaction time I'm looking at for some of the kids. Some of the kids are slower to respond, efficiency. Some of the kids are fast, but they're not very efficient. So there's fluency and speed things that I look at when those are the referral concerns. And then the handwriting types of things and dexterity kinds of things like using a zipper or being able to button buttons or put in a key in a keyhole lock. So those kinds of like manual dexterity sort of things are areas that I look at when those are the concerns. So when your child comes in for the assessment, they have a set of factors that they come in with. Some are fixed factors. Fixed factors are things that we kind of gather in the information and help with the planning of the school intervention piece. And fixed factors may include the underlying pathology, the underlying epilepsy syndrome that your child may have. There's developmental factors that come fixed with the child. Some of the kids were maybe delayed with speaking first words or delayed with motor skills. Some of the fixed factors are the laterality of the seizures or the locality of the seizures. Another fixed factor is the age of onset and how soon was the treatment started, and intellectual factors. So the intellectual factors of your child. Some kids are, average intellect or below average or above average, and that's kind of a fixed factor that involves kind of how we need to think about their school intervention and their school accommodations and what they need. And then there's other factors as part of the assessment that we look at that might change. So there's medications. Some of the medications may help with the cognitive problems. Some of the medications may help with attention. Some of the remedial factors involve seizure control. So sometimes as the seizures come under more control, some of the cognitive concerns and complaints kind of go away or are lessened. There's some of the remedial factors are understanding depression and anxiety that may be present, motivational factors, medical distress, sleep problems can be a big thing, and then the school environmental circumstances can be a big factor. We all know what happened about a year and a half ago with the whole distance learning piece. When the whole school environment went from school to home, some kids did really well with the distance learning piece, and some kids struggled with distance learning. So there's those remedial kinds of factors that can change. Other factors that affect cognition are just the history of the epilepsy. Is there a history of head injury? Did they ever fall down? Is there a history of a learning disability? Some kids had a reading disability before the epilepsy. Some kids have a history of ADHD or a family history of a reading disability or a learning disability. And are there any factors that might make them more susceptible to these sort of things? And then just briefly, when I'm looking at the assessments, just really everyone's very different and each child learns differently, but just some of the more, just generally speaking, more temporal lobe epilepsy often involves more complaints with memory and storage, more frontal lobe types of epilepsy. Parents and teachers are usually complaining more about executive skills. Some of the Rolandic type of epilepsy, some of the parents and teachers are complaining more about language. Obstinate seizures more about attention. And some of the more juvenile myoclonic epilepsies are more concerned with executive functioning. So that kind of guides our assessments and kind of what to do next about it. I just want to mention a couple more things. I know we're about wrapped up. Prognosis, it's really pretty good. Prognosis over time, kids really don't get worse. Some things that can affect prognosis are IQ scores or premorbid learning disabilities. And then what's next? Our next step is what do we do next academically? And in a second, I'm going to pass my baton over to Thayer, who works with us in the HEAL program. But what's next is understanding, what are referral concerns and what are the concerns by the teachers, and how can we support your child in school, and what sort of advocacy does your child need? Do they need a 504 plan versus an IEP? Some kids need counseling or therapy. Do they need reading interventions, academic interventions, or follow-up assessments that kind of follow them over time? But that's just kind of the whole cognitive learning piece in a nutshell. And I think I have 2 minutes. So if anybody has any questions, I want to be sure I have any questions anybody want to type in, or not sure if it's okay for people to unmute themselves.
There is a question. How do you feel about ADHD drugs?
Well, so ADHD drugs, I always say talk to your medical doctor about. So I'm a neuropsychologist. So my degree is a PhD and not an MD. And for some kids, it can be helpful. For some kids, there's seizure concerns. So bringing that kind of question into your medical appointment is helpful. Some kids respond well to stimulant medications, and then there's also non-stimulant medications. But for the medication piece, I really pass that on to the medical doctors. So the primary care doctor for your child to talk about that. But when it's not a concern and it's not an issue medically, so the ADHD medications can be really helpful. I just had a kid who I saw, and he was just not reading in school and way behind in reading. And he started some ADHD medications, and all of a sudden that brought him to the window of opportunity, and his reading just started blossoming. So sometimes that can really help with the school pieces of it. But yeah, that's a good question. Anybody else want to type in or want to unmute yourselves? You'll probably do that and ask a question. Well, that was kind of the overall talk about cognition, and I hope that was helpful. I have a last slide here with my contact information. My email is chambler@Stanford Children's. It's the first 2 letters of my first name, then my last name is Stanford Children's. Like I said, I work in the HEAL program, so I see kids from all different clinics. The last slide has the contact information for HEAL. And for the epilepsy kids that I see them at the Sunnydale Clinic on West Fremont Avenue. So that's my contact information there.
Great. Thank you so much, Dr. Ambler. We really appreciate this information you've given us this morning.
Great. Thank you. Thank you, everybody, for being and staying, listening. I'll pass the baton on now to our wonderful, super great educational person next. So I'll let you introduce Thayer.
Great.